This skill that we call staying in the now is one of the skills that we began to develop in the early 1970s, but it became a fuller, deeper understanding as we developed the body skills in the 1980s in response to the societal change that caused the cesarean rate to triple. Because the cesarean rate tripled because it was no longer really acceptable for women to have these long labors. They were all normal, natural, and physiological, but because the medical profession was just not sophisticated enough, and the response to a birth that risked a woman's life was to do a classical cesarean where she was given a general anesthetic and cut from her pubic bone to her belly button, left with an ugly scar, and would have a non-laboring cesarean if she got pregnant another time. But by the 1980s, when the medical profession developed bikini cut because we were wearing bikinis and we didn't want to be left with an ugly scar, when birth control became available, when safe terminations were available, when women wanted to go and work in the workplace, when family size was reduced, all of these things sort of collided all at this very dynamic period of time, the very late 1970s and the 1980s. And so the natural, normal, physiological, and accepted long labors of over 24 hours, 36 and upwards, was no longer acceptable. Because with the low line or bikini cut incision, we could try for a VBAC that was safer, and our partners could be with us and we could be awake. At that point, there wasn't really this division between if you have a cesarean, it's not really a birth. It was just that we could now give birth with surgical means and then try for vaginal birth next time. And I want you to keep in mind that almost every cesarean is done when a woman is in labor, not in the vaginal part of the birth. So when you have a VBAC, vaginal birth after cesarean, you still have to get through labor, which brings us right to the title of Staying in the Now. There has been a confusion with the messages given to women. Grantley Dick Reed, who wrote a book in 1959, was Childbirth Without Fear. The implication was that women shouldn't be afraid of birth, and that if they aren't afraid of birth, they won't tense up. And if they don't tense up, they won't feel pain. In other words, they'll have a pain-free labor because they weren't afraid of birth. That's actually not accurate. In the 50 years that I've been involved in birth, there is no correlation between how a woman feels about birth, whether she has fear or not, and how she perceives of the labor contractions that she experiences. We're all controlled by the global childbirth concept, number one. You never know what your birth is going to be like. It's true. That's true. You never know what your birth is going to be like. So you cannot be afraid of birth and find birth to be incredibly painful, and it can last for a very long time. Or you can be terrified of birth, and your birth can be almost pain-free or perfectly manageable over a reasonable period of time. There's no way to know what our birth is going to be like. So we were developing skills so that we could deal with our births. And why did we want to do that? Because the birth of each of our babies is important to us, and it's an activity that each of us has to do with our baby. In Birthing Better Families, we're dedicated to the mission of developing skills for all births and every little nitpicky little thing that came up, because we're all asking similar questions. What could I do? What should I have done? What might have happened? What if, and how? And so we're answering those questions. One of the things that happens with women in labor is that if the labor begins to be progressive and the contractions come closer together, they're longer and they're more intense, women can move from a space of feeling somewhat comfortable because they're sort of manageable to feeling uncomfortable. And when women are feeling uncomfortable and they lack skills, then they start to feel out of control. And when they start to feel out of control, they begin to future trip, which means the next contraction. They're scared or anxious about the next contraction. And this is legitimate because as our labor progresses, our contractions can get longer, closer together, and more intense, which means we have no idea what the next contraction is going to be like. And when we lack skills, we have few resources to cope, manage, work through, handle, stay on top of, feel in control. And when we don't feel in control, then birth becomes a nightmare to us. Some women are absolutely convinced they're going to die. In fact, many men take a look at how intense the pain is and think, is she going to die? Is there a problem? And when birth professionals act as though there's nothing the matter, it is because the pain of childbirth is unique and not likely to lead to death. And the pain of childbirth is not directly related to whether there are risks or no risks, problems or no problems, how problems resolve themselves, or even tragedies. The pain of labor is connected to the uterus tugging open and retracting the cervix and the tissue surrounding it into the bony pelvis, the middle part of our sacrum, the middle part of our hip blades, and the middle part of our pubic bone. Just think about it. We have a closed cervix. That means the aperture, the opening, is tightly closed. Nothing goes in, nothing comes out. That's tightly closed. When a woman's body and the baby prepare for birth, she develops Braxton Hicks contractions. Those Braxton Hicks contractions can begin to efface or stretch this tissue that's the top of the vagina back into the pelvic bones. And that becomes smooth. The tissue becomes smooth if you feel it rather than puffy. And still, the cervix can be tightly closed. Then at some point, the contractions begin to tug open this tightly closed cervical opening. And it has to go from tightly closed, where nothing can fit into it, to that. So it goes from that and it goes to that. And that's what takes time. A short labor might be 3 hours. Long labors can be 96 hours. Because you never know what your birth's going to be like. You have no idea what the next contraction's going to be like. So Birthing Better families were asking questions of how do we deal with this? And what we discovered was our greatest skill was to be in the now. Present time. We don't think back on the last contraction. We don't think forward to the one that's coming. We focus our attention on using our skills in the now. And we do that primarily in 3 areas. We're going to breathe in and we're going to breathe out. Our body is in some posture or position at all moments. And our head is thinking at every moment. So we use these 3 primary areas to make certain that we just are staying in the now. We did that by developing the Birthing Better breathing skills, understanding the 4 ways humans breathe: in the nose, out the nose, in the nose, out the mouth, in the mouth, out the nose, in and out the mouth, and then going through each of those to find out how do we use those in life. How do we use in and out the mouth? You play around with it. Some people run while breathing in and out their mouth. Some people have blocked noses and they're mouth breathers. How do we use in the nose and out the mouth? That has the greatest variations. It can range from blowing out to slack jawing out. And when we see or hear that, we know that we're trying to relax. It doesn't tell us anything about our mind, but we're making an effort at the moment, in the now, to relax. But in the nose and out the mouth can also sound like this. Ah, ah, okay. Or, ah, ah, okay. Or, ah, or, ah. So as we go through the variations of in the nose and out the mouth, it becomes obvious which ones give us more control and show that we are coping fairly well, and which ones are showing that we're not coping well. And when we don't cope well, we tend to project into the future, the next contraction. So when you have a labor, know that your contractions are going to get closer together, stronger, and last longer. And as you apply breathing skills, also think about what your body is doing. Your baby speaks to you through each contraction. This is another skill that we learned, which is in the progression of labor. We learn that when our contractions start, begin to rise in intensity, have a strong peak, begin to dissipate and go away, that is a message our baby is sending us that, Mom, there's nothing in you, no tension in you. There is not a position that you're taking that's stopping me from opening you up. Effective, progressive contractions always have a peak. When we have a contraction that starts, goes up, but then stops and just sort of plateaus off and then somehow wanders away, that is our baby saying to us, you need to consider the positions you're in or the posture of your upper body, or soften the inside tensions that you might have because something isn't working for the baby. And so we become more aware of the positions that our upper body or lower body or both of them are in. For some babies, if a woman is sitting up and she leans forward, it stops the contraction from being effective. Something in leaning forward is changing the relationship of our baby to the inlet mid-pelvis, and it doesn't like it. It's the same with using hands and knees. If we're having intense contractions and we feel we need some relief and we get onto our hands and knees and the contractions back off and they're less intense and further apart, the baby is telling us that it is no longer in an effective alignment to the inlet and mid-pelvis, and therefore it's backing off the contractions. So we might like it, but our labor is usually longer. So we want to have skills to deal with the changes in labor. And we want to use those skills to stay in the now, to be present, to use our breathing skills, to use our body positions and posture skills, and to use our mind to make choices about what skills are the most effective at any moment. And also when we have negative thoughts in our mind, we know that they just are there. And we can use the management part of our mind to continue to apply skills on a moment-to-moment basis. And our partner can help us because when they hear our breathing become ragged or stressful, they can model good breathing for us, and we will follow them and then breathe with them. So staying in the now is really important. We make decisions in the now during birth. For instance, in second stage, if we're sitting in our sacrum and our baby can't push that back and out, and we feel that pushing is not effective. If we have skills to change our position, we make those changes and we look for contractions that have that strong peak. It's a skill that's well worth developing because we use it as a parent. We have to stay in the now with our children. Some of us resent that because we've never had to do that before. And giving birth is a place to practice being able to do that. If we have a non-laboring cesarean, many Birthing Better families loved learning the skills because it gave them an intimate relationship to each other and to their baby. And then they used the skills on the way to the hospital. They saw that as their labor. And they used the skills as they waited for and then were prepped for surgery. That was their transition. And then during the surgery, that's their baby's birth. In other words, they chose to stay in the now and not let birth just happen to them, but engage at every single moment of the birth because their baby's birth was important to them. And they chose to use skills to work through the activity of birthing their baby. So this is one of the great Birthing Better skills. Stay in the now.